We're learning a tremendous amount now about the molecular biology of bladder cancer, largely from the change in technology and the availability of doing the testing. We're realizing that bladder cancer isn't one disease. From a molecular standpoint, there are multiple different types of bladder cancer. In the future, we're going to be able to exploit those differences, and the field is ripe now for additional testing new drugs to try and match up with these agents or molecular changes. Testing that's going to be able to identify targets in different pathways that we, in the past, maybe didn't think were appropriate for bladder tumors. It's also identifying potential markers of outcome, predicting responses to different therapies so we can better select patients for particular therapies, who's going to respond, who's going to be resistant to therapy, as well as potential markers that may help us identify who has more advanced disease at the time of presentation. This may better allow us to select patients for combined therapy. If we know people have a higher risk of developing disease outside the bladder after local therapy, these patients could be selected up front for some form of combined treatment modality. Whereas patients with a good outcome with local therapy alone perhaps could avoid the need for additional systemic therapy.